Hello, and welcome to Becker's Health IT and RCM virtual event. Thank you for joining us for today's session, utilizing tech-enabled services and solutions to solve the manual prior authorization workflow. My name is Aaliyah Pavla, editor at Becker's Healthcare. It is my pleasure to introduce today's panelists, David Tassoni, President of Access Healthcare, and Steve Kim, co-founder of Voluware. Before we dive into our conversation today, I'm going to turn the floor over to David and Steve to introduce themselves and explain a little bit about their companies. And David, I'll have you go first.
Great. Hello, everyone. My name is David Tassoni. I'm president of Access Healthcare. Access Healthcare is a global delivery company in our revenue cycle management. We are about a 12-year-old company with 19 global delivery centers across India, Philippines, and the United States. We have about 12,000 associates, part of our company, that are working hard every single day to help serve our providers and billing companies, helping to make healthcare work the way that it should.
Thank you. And then Steve?
Yeah, so my name is Steve Kim. I'm actually a pediatric surgeon by training, and also co-founded Voluware out of the frustrations that I found in my own practice with prior authorization workflows. At Voluware, we really focus on providing workflow automation technology to really strip away a lot of the manual activities involved with prior authorization workflows today. We currently work across a broad footprint with provider organizations, both from multi-specialty practices as well as large academic medical centers and health systems. And so that's my background.
Thank you, Steve. And it's awesome to have you both here with us today. So I'd love to kick off our conversation by asking this first question, which is, how did you both get involved with prior authorizations? And then I'd love also for you to explain how Access Healthcare and Voluware came together as partners in the industry. And Steve, I'll have you take this one first.
So once again, I'm a pediatric surgeon, practiced here at Children's Hospital in Los Angeles for the better part of the past decade, and co-founded Voluware really out of my own practice's frustrations with prior authorizations. I think where I first came around to understanding the impact of prior authorizations was in my own practice with the children that were having their surgeries and their services canceled on the morning of due to the fact of not getting the authorization secured in a timely manner. And certainly this was distressing not only to myself, but to the families and the children that I was taking care of. I think as time went on and I spent more time involved in my institution's committees as an ambulatory physician, ambulatory EHR go-live physician champion, I began to see the financial impact that authorizations were having, not only in my practice, but also in the hospitals as it came to denials and avoidable write-offs. And it was really at this point that I became extremely frustrated with prior authorization workflows and went to my office manager to ask her what was going on. And I still have this really vivid memory of her pulling out a 3-ring binder chock full of prior authorization fax forms that my team had to fill out by hand, and there were over 250 different fax forms. In addition to that, there were well over a dozen websites that they were having to go ahead and submit into. And so this was really the crux of kind of what we set out to solve with our Valor workflow automation technology. So I've been doing this for about 8 years, and certainly there's a tremendous amount of opportunities for the technology to strip down and automate much of the manual activities. But I think the part that certainly interested me was the fact that what we understand about the market today is there's a significant amount that can be done by technology, but certainly there's also still a legacy vestige of manual workflows that still exist, and largely due to the payers' requirements. And so this is where the concept really came about in our discussions with Access and David's team about creating a tech-enabled service offering, really putting the best parts of the technology with the best parts of the service together.
Thank you so much, Steve. And David, I'd love to hear your side as well. From your perspective, what got you into prior authorizations, and how did you end up teaming up with Steve and his company?
Well, I will tell you that my experience has almost been from the exact opposite side of Steve, whereas Steve has been a provider. I've been an RCM executive for about 15 years, that has helped providers to complete functions such as pre-authorizations. And my most vivid memory goes back to a time when we actually acquired, the company I used to work for acquired a regional pre-authorization services company that really used very little technology and relied a lot on that localized human experience that Steve just talked about, expertise that Steve just talked about, the type of information that fits into a 3-ring binder that is in the heads and the knowledge of those individual people. But I'll never forget this Saturday morning, this snowy Saturday morning, not long after we acquired the company, that I received a phone call from one of the most famous sports orthopedic surgeons that we have here in the US. And he wasn't calling me to tell me how great I was. He was somewhat irate about the fact that he needed to reschedule 2 Monday surgeries because we had not completed the pre-authorizations on time. And this wasn't the first time it happened. He should have fired us a long time ago based on what I later discovered were some gaps that we had in the process. But we were a better alternative than what he really was dealing with in his team that didn't quite have the knowledge, didn't quite have the time to deal with it. And what we found is that our key gaps were really in the process and in the transparency. I believed coming into this that there was payer visibility, that you could see what was going on through some of the technology and transactions, but you really couldn't. And what we recognized we had in there as well was a poor flow management problem. And we solved, if I fast forward now a few years later, we solved the flow management problem. But it still is a pretty inefficient process if you don't have a technology solution with you to guide you and bring all that information to the forefront. And so that's why we sought Steve, and we were so impressed when we found Voluware that we just felt like it was a sort of a partnership that would really help us leap things forward.
Great, thank you, David. That's so helpful to understand. So in the last question, you both mentioned multiple challenges that you have experienced with prior authorizations. And Steve, you referenced how incredibly manual and time-sensitive the process can be, specifically a 3-ring binder. Can you tell me a little bit more about that?
Sure. Yeah, I think the 3-ring binder is really emblematic of what I see as one of the real core challenges around managing prior authorizations, and that's the highly manual nature of prior authorization submission workflows, right? And so I'm not, at this point in time, still today, about nearly 90% of the workflows that we see around authorization submissions still require manual intervention by a person, whether that's filling out fax forms, logging data and typing it into a payer website, or being stuck on the phone call. And as you can imagine, this is an incredibly time-intensive and quite costly function to kind of fill. The CAQH in last year's index report really estimated that the average time it takes to complete an authorization manually is around 21 minutes at a cost of nearly $11 a transaction. So that's quite a burden on teams having to do this in a manual fashion. Moreover, the problem that we see is really there's also the introduction of a lot of errors and inconsistencies that kind of can flow through and propagate across the entire revenue cycle that really leads to a lot of the headaches on the back end that David and the folks at Access Healthcare can really appreciate. And so that's one of the main drivers of so much of the dysfunction around authorizations. Another component, the first question I began to ask myself is, why is it really so manual in the 21st century? And that gets back to some of what David was alluding to in terms of just the highly fragmented and extraordinarily variable workflows that the payers all have around authorization requirements. And there's an absolute lack of any standard format. So what that leads to is a variety of different idiosyncratic workflows that payers subject teams to. And these workflows can be highly specific down to the specific service line, the medication that you're dealing with. And this speaks to a lot of what David had commented a little bit earlier about that human knowledge that's at play. And so those are some of the key critical aspects that I see, certainly from our perspective in managing the prior authorization problem.
Thanks, Steve. And David, do you have anything to add?
Yeah, I think what I would add is that, one thing that I've often noted is which may be obvious to people, is that the reason I think that the challenges are harder to solve in pre-op, unlike some other RCM processes, is because, as we both pointed out, there is probably the most firm and tightest deadline in this process, and that is the appointment. You can't move the appointment. You don't want to move the appointment. You can always, follow up on a claim later if you want to, but you really can't, follow up on a pre-auth later, because the appointment is set in time. And so that has always been, I think, to be one of the challenges that has made it very hard to sort of deal with this. But I'd probably break it down into a couple of other factors that are similar to what Steve talked about. And the first is that one of the key factors is this variability that Steve talked about. This every payer has a different process. That localized knowledge is necessary, but when you have that much variability, that's where you get errors. That's where you get process adherence problems. That's where the quality doesn't happen. And when you don't have a whole lot of visibility, that human error can really take on a huge impact. That's why cancellations occur, is because you had that human error in the first place. The second thing I think about is that predictability. You don't know how much time it's going to take to complete all the preset certs. You have a sense of what they are, and you may be able to model that out over time, and there may be technologies available, but the time to actually complete it is very unpredictable at times. So when to start, it gets unpredictable. What is going on with that, the visibility into it I just mentioned, and then that accuracy. You're not sure if what you submitted was wrong, and the worst thing in the world is you actually get a response back that it was wrong one day before the surgery, and then you can't do anything about it. So that predictability part is very difficult. And then the last part, which is where we really think about a lot of access healthcare and where that human element comes into it, is one of the biggest challenges I think health systems face today, and that is availability of staff. Having the staff available at the right time to do the right work that needs to be done at that moment. And I do think that is the sort of hidden promise of outsourcing more than anything else. People talk about outsourcing all the time from a cost-saving standpoint, but the reality of it is it's that availability and consistency of staff that really matters, and that's what we think, adds a significant portion to what those challenges are.
Yeah, and maybe just to kind of dovetail on those last points that David made, and that's certainly something that we see as a technology company. There's a tremendous amount of the variability that's associated with both what comes through the electronic health record and the payer requirements that we see, but certainly there's a lot that we can manage through automation of those non-value-added activities, but it's that variability component that can sometimes impact that workflow. And because we understand deeply that there's a role for technology, but there's also a role for people, that that's where a lot of efficiencies can also be additionally gained just beyond the automation that we deliver as a platform. And so it's an important concept to understand about the consistency of the overall process, is how you improve both efficiency but also the accuracy that allows us not to end up with a canceled patient surgery.
Absolutely. Thank you both, David and Steve. I heard a lot of challenges, payer challenges, staffing challenges, just the process in general being manual in nature, as well as the variability. Can you describe what you see as the solutions to these challenges in the marketplace? And David, I'll have you take this question first.
So obviously, just based upon the title of what we're talking about here today, we do believe that utilizing a tech-enabled service, really is what is important. And I'm going to let Steve go into some more of the detail about the system, because the technology obviously is a key part of this. But the way I always like to think about it is it's sort of broken down into three things from a solutionary standpoint. It's first and foremost, it's creating that consistent workforce, have this optimized staffing that is always there at the right time to be able to do that. That's the outsourcing component of this. The standardization of the work, optimizing the workflow, organizing the process so that all of the workflows are minimizing that handoff from team to team, or is eliminating the handoff, is a key part of it. And then the last part, which again will continue to expand over time, is this automation. There's so much, as Steve pointed out, that is the non-value work that happens in here. And if we can reduce that or eliminate that or let the technology deal with that while humans are dealing with the more complex work, I think we create it. And I think that's really what a tech-enabled service is supposed to do. And this process is right for that. And we think it's a perfect solution to bring to the table.
Yeah, and just to kind of dovetail on those comments, it's exactly the similar thought process around the tech enablement aspect that Valor brings to the table. So Valor is upstream of all that human activity, and our Valor platform is a cloud-based solution that really is designed to eliminate all the manual activities we talked about, the traditional fax-based workflows, as well as delivering automation of web portal submissions, which is one of the more technically challenging parts. And so that part upstream is kind of what Valor is well positioned to automate and bring order and structure and standardize around. So there are really two key components of what our Valor platform does. The first and foremost is integrating with electronic health records. As David mentioned, you have to know when the order has been dropped and the surgery's been scheduled that kind of can trigger these workflows downstream. And so these are the components that we are able to bring in more of a structured format in our Valor platform and drive some of the work queues and workflows that are downstream. There's also quite a bit of understanding and deep knowledge that we bring to the table as technologists around the provider EHR workflows, and this tends to be a heavily workflow intensive activity that helps us understand exactly for that particular team and that particular service line or modality, whether it's MRI or medications or surgery, what exactly should be triggered from that. On the other side of the coin, when it comes to managing the extraordinarily varied and fragmented payer workflow, that's really the strength of our Valor platform. As you can imagine, there are thousands and hundreds of thousands of different permutations of what payers can require and request related to prior authorizations. And that's what our Valor platform is capable of painstakingly mapping to provide some structure and order to that process. And so really we're upstream of the processes that David has built with his Access team from the human side and component of it. And what Valor does is really organize, structure, standardize this payer interface, but also importantly, we're automating so much of the manual work that's involved and just transferring information from the electronic health records into the various different payer formats. And so that's really one big part of the technology. The other part that can help inform the improvement of processes overall is really creating a standardized learning framework where we're actually understanding all the different payer nuances on the front end for the submission part that we can begin to drive that consistent high quality submission process with the technology. So really this is the marriage of technology managing all the disparities in the EHR workflows that people see, all the significantly complex and nuanced payer requirements, and structuring that in a place that's very manageable to kind of hand off to a partner that has that service component to bring that high quality level of the human workforce to that equation.
So one thing I would add to that a little bit, and that really comes back to sort of this concept that Steve and I have talked about a lot, that it's so critical in revenue cycle management, and that is this idea of creating this closed loop process. And I believe that Valor Access together creates a closed loop that is absolutely necessary in any healthcare process, but it's really doing it, you know, to really talk about what Steve talked about in two ways. First, it reduces those handoffs. So the person is responsible for completing the task, in this case, submitting a pre-auth, is more directly tied to the outcome of that task. And so they alone are completing all of the steps guided by Steve's workflows, by Steve's information, and they don't have to hand it off to another party or another expert to finish up. That's where things break down. But the second one, and this was Steve's last point about that continuous learning process, is that with any robotics or machine learning platform, I believe there has to be this aligned incentive or a process that feeds that learning. So our users who are completing the work are highly motivated to give that feedback into that RPA platform and help Valor become smarter over time. And to us, that is really the partnership that we've created on this, where we're both working together to try to, at the end of the day, make the most consistent and most an automated platform we can bring to the table, because we know at the end of the day that is where the errors are most reduced, and that's really where that's really what we think is the core of the solution.
And that is really the bigger power of the tech-enabled service offering, is having that continuous feedback in that closed loop, as David mentioned, and really informing, that learning mechanism that we have built in on the front end on the Valor side, right? So the payer rules are constantly adjusting and changing. We know that in real time. There are new forms that are coming out. And really it becomes the right way, a proactive approach to dealing with authorizations and getting them right from the front end to get that clean process set up. And that really requires, feedback for the platform to really learn over time. We get that from 2 points. One is from the users themselves, kind of at the point of submission requests, being able to structure that in a way that we can learn based on that activity. But as David said, looking at the denials, looking at the areas of the billing and coding aspects that fall through the cracks, we can begin to immediately feed that back into the front end to adjust. And I think that's what really starts to sharpen the overall process of both submitting, verifying authorizations, as well as how it trickles across the revenue cycle.
Fabulous. Thank you both for sharing the solution and a little more of the details behind it. So I have one last question for both of you, which is, what are the results are you experiencing, or what results do you expect while utilizing a tech-enabled solution and service?
Yeah, so maybe I'll start off with some of the results that we're seeing with the concept of really grabbing hold and organizing the messy front-end process as it pertains to EHRs and payer workflow. So at a large academic medical center in Southern California, we have been able to conduct a time motion study looking at the overall processing time. So once again, the Valor platform is really intended to strip out all the non-value-added manual work that goes into it. And some of the results that we've seen there was an upwards of an 80% reduction in the overall manual processing time for authorization. So going from an average of 16 minutes down to 2 minutes. And that really gives you a sense of, in this overall world of the manual activities that are involved, really the ability for technology to compress that and to automate those functions and allow the people, the human element, to really use their knowledge base and their expertise around that process to really drive efficiency. And so that's one example of how the technology piece can help complement removing the manual activity work to really even further supercharge the staffing on components to authorizations. Another thing that we've also seen is the ability to maintain productivity or do more with reduced staffing requirements with our Valor technology. And this really occurs from, once again, taking away all the filling out of fax forms, all the logging into the websites, which we can begin to automate those processes, and certainly drives a lot of that efficiency. And certainly in this day and age of COVID, where staffing levels can be challenging, we find like that's the first component of what we can bring to the table, is the technology component of that tech-enabled service offering from our standpoint.
Yeah, what I would probably add on that is that, from our perspective at Access Healthcare, when we typically deploy a technology-enabled service, whether that be a computer-assisted coding platform or our own guided workflows for any process in RCM, we typically see anywhere from a 30 to 50% reduction in labor costs. So, Steve is seeing labor reduction right now today in the health system or the provider group, because it is improving their productivity. But obviously we're seeing a bit of a higher part when you talk about us being an outsourcer. And labor arbitrage plays a significant role in this, of course. But even more, and I do think that this is what we are experiencing and expecting to see out of the platform even more, is that when we do deploy technology-enabled service, we see somewhere in the neighborhood of 98% plus human QA scores. Human interaction is rarely ever 5.9, in a Six Sigma, capability. You need the technology to be able to get to it. But what we're seeing is that the human interaction that we can do, because it's guided, because there's process maps, because the knowledge is at your fingertips, because you're not doing the data entry, you're pulling data as opposed to entering data, it significantly reduces that chance of error. And we're seeing very high quality scores when we do this. Not to mention what we always measure, and that is our turnaround times and us having that adherence. And that really is due to workflow design. Again, knowing where to be at the right time, when to act on something that needs action today is a key part of this. And so we significantly see that turnaround time improve.
And just to kind of actually add on to that last comment is that, you know, we work with several large organizations where we see that element of variability in terms of the consistency of the human aspect and the workflows on that. And so certainly there's a tremendous amount upstream that we can do in terms of processing the information out of the electronic health record, understanding what the payer requirements and workflows are to help provide that guided process. But there are certain organizations that, you know, would benefit from having much more of that high quality consistency around the submission process. And I think that's what I certainly appreciated about the conversations that we've had with David and his team from Access, is their real fundamental commitment to that level of service and constant improvement. And I think in many ways, that's what binds us together to really deliver the best return on investment and ultimately the outcome for the patients that we can by combining this as a tech-enabled solution.
Really good point to add, Steve. And also, those are just incredible results that you have seen already, and I'm sure we'll continue to experience as well. Unfortunately, that is all the time we have left for today. Steve and David, thank you so much for your time and your thoughtful remarks today. And also thank you to our attendees for taking some time out of your day to be a part of the Becker's Health IT and RCM virtual event. Thank you again for joining us, and we look forward to seeing you at future Becker's events.